how does the type of hair loss determine the kind of treatment you're going to go?
Well, let's talk about the less common forms. If you find something that's not related to genetics, such as what we call scarring alopecia, so or those patients that have focal hair loss patterns, those can be treated typically with anti-inflammatory medications, steroids, for instance, to at least control that type of hair loss pattern. And you need to rule out those hair loss patterns before considering a surgical procedure like a hair restoration procedure, a hair transplant procedure, because in some cases patients are not amenable to a hair transplant procedure. Whereas patient with a genetic type of hair loss pattern, those are very amenable to hair restoration surgeries.
Now, what type of doctor would perform or manage hair loss?
A hair loss specialist can come from various fields, but typically they are dermatologists, plastic surgeons, facial plastic surgeons, even a primary care physician as well, but you need to have a specific background and training within hair loss.
Now, we have a list of questions a doctor might be interested in if a patient comes to them with hair loss concerns. So let's go through these and talk about why the answers might be important to you, Dr. Barry. Can we start with the first one, basic one? When did you first begin experiencing hair loss?
That's important to know because you want to know when, where you are in that person's stage. So for instance, if they first started experiencing hair loss in their 20s, and then now they're in their 40s and they haven't really progressed that far, you can really at least see the progression of hair loss. So it's important to figure that out at first.
Because people have hair loss different...
They progress differently.
Yes.
Correct. So ultimately it's kind of like the a slow march, but it's a little bit faster for others.
Right. Okay. So then the hair loss continuous or occasional, which is kind of what we just touched on.
Correct. For the vast majority of cases, you want to figure out how it's progressing, if it's slowly or quickly. In nearly all cases, it is continuous.